Good afternoon to you all.
Good afternoon, sir.
Good
Good afternoon, sir.
Good afternoon, everybody.
Good afternoon, sir.
Yes, I hope you are all doing very well.
Yes, sir.
Yes, sir.
By His grace, we are fine, sir. Please, sir.
Okay. Yes, today we are meeting for the first time to discuss and start your second semester course in medical nursing 2. I am Mr. Ernesto Poku Entry. Some of you know me on campus during examination, those in Kumasi and other centers, I normally come there. And I've interacted with most of you before. Normally it's Mr. Musa who takes the medical nursing 1, and I will take the medical nursing 2. But I learned there was some slight error, and because of that, instead of my name here, I think the person repeated Semusa's name. So there was a correction to that. So I have to do 1 or 2 adjustments to meet you. But all the same, we have started, and the content is very, very deep. And for that reason, we wouldn't want to waste any time, but to kickstart as soon as possible. Okay, so that is my name, Medical Nursing 2. The course code is Nurse 318. And that is my email address. You see my email address there. You can pick it, and my telephone number is also there. The course content, we have course introduction, an assessment of patients with musculoskeletal disorder. So we have assessment of patient with musculoskeletal disorder. So here, our first introduction is going to be on musculoskeletal system. Musculoskeletal system. And that is what we're going to do for the first 2-3 weeks. Will be centered or based on musculoskeletal disorder. If you see the red ink, initially, when we started the CODel program, I was doing both medical and surgical. So you see the red, mostly it was meant for the surgical side. And then when we split it, or when we divided, I have to highlight it with red. So we are not going to consider those red inks, but to focus on the black ink. So we look at disorders of the skeleton, scoliosis, lordosis, kyphosis, osteogenesis imperfect. We will look at this. Then we will come to unit 6, where we look at osteomalacia, osteoporosis, Pigget disease of the bone. Then we look at gout, and the gout we look at osteoarthritis, rheumatoid arthritis, osteomyelitis. Sequestrectomy is under surgery, so you discuss sequestrectomy under surgical nursing. Headaches, that is, if you look at unit 8, we have ended the musculoskeletal disorder in or at unit 7. So we are starting nervous system from unit 8. So under unit 8, we look at headaches, seizures, and epilepsy, Parkinson's disease. Then we will consider if it's possible to organize a mid-semester exams. We'll do that. Then we look at the brain tumors. Brain tumors. Under the brain tumors, look at complications, classifications, gliomas, and meningiomas. Pituitary, acoustic neuromas, and metastatic tumors. The same nervous system will look at Alzheimer's disease, Huntington's disease, and multiple sclerosis. Unit 13 will be looking at peripheral nervous system, that is Guillain-Barré syndrome, myasthenia gravis, and polyneuritis and polyneuropathy. That brings us to the end of nervous system. So we have considered 2 systems for now. Then we'll look at dysrhythmias. Dysrhythmias will be discussed under the cardiovascular system, and more importantly, under the electrical impulses. So we look at abnormal impulse discharges from the SA node. So we look at terminologies under dysrhythmias or arrhythmias. You can either talk about or mention it as dysrhythmias or arrhythmias. Anything beginning with A is an abnormal, so abnormal rhythms. Terminologies here, we look at sinus arrhythmias or dysrhythmias. Then we look at atrial dysrhythmias, and we look at junctional dysrhythmias, ventricular dysrhythmias, atrioventricular blocks, where the impulse doesn't reach the ventricles at all, but rather arrested at the atrioventricular node. Then we move on to look at cardiac conditions. So here we look at heart failure, valvular heart diseases, mitral stenosis, mitral regurgitation, mitral valve prolapse, aortic stenosis, aortic regurgitation, inflammations of the heart, and infections. Here we look at infective endocarditis, pericarditis, rheumatic carditis or rheumatoid carditis. Then we look at cardiomyopathies. We have the dilated, hypertrophic, and restrictive. Dilated, hypertrophic, and restrictive. Then we look at vascular problems. You know, the cardiovascular entails the heart as the cardio, the vessels as the vascular system, and the blood that runs through the vessels as the hematogenic or hematopoiesis or hematogenic conditions, where we look at conditions of the blood itself. Talking about sickle cell, GCSPD, those conditions are purely blood-borne conditions. So here, vascular problems, we look at atherosclerosis, hypertension, peripheral arterial diseases, acute peripheral arteries, acute peripheral arterial occlusion. Then we look at aneurysms of the central arteries, aneurysm of the peripheral arteries, aortic dissection, Becker's disease, subclavian steel, Raynaud's phenomenon, thoracic outlet syndrome, peripheral venous diseases, venous thrombosis, varicose veins, phlebitis, and venous insufficiency. The content is really choked. It's not easy. This will be looked at under vascular problems. Then we have to look at diseases that come under the coronary artery diseases or conditions. from the left ventricles, as the blood moves through the aorta, somewhere around the arc of the aorta, there's a sharp branch that supplies the myocardium with fresh oxygen and fresh nutrients to the myocardial tissues to enable the myocardial tissues to work perfectly. That branch of blood vessel that carry blood to the myocardium is called the coronary artery, and the diseases affecting these blood vessels will be put together as coronary artery diseases. So under the coronary artery disease, we have the stable angina pectoris. Then we have the unstable angina pectoris, acute coronary syndrome. Then we have the myocardial infections, sudden death syndrome. Sudden death syndrome. So here, we still need to include myocardial infarctions. So the myocardial infarctions is here. Myocardial infarctions is here. I really mentioned it. Yes. Then we come to the hematologic problems. That is the blood-borne diseases. These are the red blood cells. So here we look at anemias. If only time will permit us, because remember we meet once a week. If it's the regular school, we'll be meeting twice a week, but we meet once a week. So the fact that we meet once a week means that we have a lot to cover. So under no circumstance will you have to skip a lecture or miss a lecture, because once you miss a lecture, you miss a lot. And for that reason, I don't necessarily, or most of the time, I don't miss my lectures, because the time is not that much for you to forgo some of them. And the content is very, very important to me. So we have anemias resulting from increased production of red blood cells. So we're talking about increased production. We are talking about the raw materials that you need to manufacture the red blood cells. In other words, erythropoiesis. And what do you need? Those are the vitamin B, the folic acid, the ions, and the site, which is the red bone marrow, where the production takes place, and the source from the kidneys, where you need erythropoietin to ignite the fire for erythropoiesis to start. So we look at all these conditions. Then we look at conditions that result from increase. Okay, I initially talked about condition resulting from increased destruction of red blood cells. So here we look at, for destruction, we look at sickle cell disease, GCSPD, that is GCSPD, glucose dehydrogenase enzyme deficiency. Then we look at immunohemolytic anemias. So anemias resulting from decreased production of red blood cells. So decreased production here where you talk about lack of iron, I was talking about vitamin D deficiency and folic acid deficiency. Then aplastic anemia, look at anemia resulting from the problem with the site. So we talk about the polycythemia, and the polycythemia vera will be talked about here. Coagulation disorders, autoimmune thrombocytopenic purpura, thrombotic thrombocytopenic purpura, hemophilia will be looked at here. Then we look at transfusion therapy. Transfusion therapy. Under the transfusion, we look at the pre-transfusion responsibility as a nurse before preparation you do before transfusing blood. We look at transfusion responsibility, types of transfusion, red blood cell transfusion, platelets and plasma, cryoprecipitate and granulocyte transfusions. Then we have transfusion reactions, where we look at hemolytic transfusion reactions, allergic transfusion reactions, febrile transfusion reactions, bacterial transfusion reactions, circulatory overload, transfusion-associated graft versus host disease, or then autologous blood transfusion, here where we transfuse your own blood to you, especially in the cases of ectopic gestation, where emergency CS is carried out, and probably if the circulatory system recognizes that the blood is too low, blood is filtered to remove the clot. And once they get your own blood, please, the person who has opened the microphone, close your microphone before I take you out. I think before I start to teach, I have to put the rules clear to you. If you have not learned anything at all, at least you need to learn how to mute your microphone as soon as you connect to the Zoom. And this will prevent distraction to everybody. If you allow your microphone to be on, it is assumed as if you have entered a class and you are making noise when lectures are going on. This is a class, and it is representing the classroom. And under no circumstance, at your blind side, will you allow your microphone to be on, to pick your background feed. It is so unfortunate for students to ignore these directives. And I'll be very, very hard on you if you keep on doing this. I will first give you the warning. I will give you the second warning, and the third warning is possible. I will probably take you off that particular day if you don't heed to advice. So I was explaining the autologous blood transfusion, and I was citing an example in ectopic gestation where your own blood is given back to you. All right, so we look at revision week and end of semester presentations. So we look at the reading materials here, give the reading materials. It's been updated, and I'll give you the updated version very, very soon so that you can read these materials. Okay, so the rule is, I have just mentioned one rule for you to follow or to pick. The class rep will definitely prompt me that the class is ready. I will connect, or they will give, now the connection is from the IT office. So they will connect and then they will hand over the co-host to me so I can co-host. Now, as we connect, we try as much as possible to mute our microphone. We are human beings and we may forget to mute our microphones. So we will be giving you the alert that mute your microphone, mute your microphone. What happens is that most of the students will connect. They will not be with the phone to listen to the lecture. They will just connect and leave the phone and do some other things. Some may be at the wedding grounds, some may be at the funeral grounds, some may be at the prayer camp, some may be doing their own things. Some may be at the lorry stations, some may be in a vehicle, but they will not pay attention to the lecture. So even if the microphone is on and you alert, because if you are with the microphone or with the phone, as soon as we picked an alert and we ask you, because I'll definitely mention your name, maybe student A, B, C, your microphone is open, please kindly mute it. If you are with the phone, once your name is mentioned, you quickly run or react and mute your microphone. But because you leave the phone and do some other things, you are not with the phone, so you don't know what is happening. Probably the something has happened and then the mute has been unmuted and is picking the background noise. So we keep on giving you the alert, mute it on several. Okay, if you keep on doing that, then we have no option. We can't allow you to disturb the whole class. Then we take you out. And once we take you out, remember, you can't join again except you join the next week lecture. So that particular week, for that particular class, you miss it out. But other classes you can join. So please learn from this. At least you have gone through a whole semester. So if anything, you have been able to pick some experiences. You are no more new students, and we need to get more perfect and better as time moves on. Okay. Apart from this, we have materials. Every university, we have material. Unfortunately, you are not on campus to visit the library. So, Medical Nursing 2, I have my books published at the bookshops, Kale bookshops, Kingdom bookshops, and through your class rep. If only that you need one, you just see your class rep. From the bookshop, the books have been published there. You can get one and read. That will guide you. The content will never be the same as the slides I'm giving you, because the slides are more or less a skeleton and some other areas you can read in addition. It's not possible we can finish, or there's no, I don't think we can finish the content, but I think the material that have been put together has everything together. So this is not by force, and I make it clear that this is not by force. And I know how students will go and interpret it differently elsewhere, because some of you are related to others. But the truth is one, my books have been published at the shops. It's not only meant for GCUC students. Other students are even rushing for it. It's not only for GCUC students. So if you're in GCUC and you don't want it, nobody will force you. Nobody will force you. If only you want to depend on the slides alone or read elsewhere, nobody is preventing you from doing that. All right. Any question? Then we'll have our mid-semester exams. A notice should be given earlier through the class rep, CODel, and CODel will give you the information that we'll be doing probably mid-sem in the next 2 weeks or so. So you prepare ahead of time. So mid-sem will be done, and through that, we will be able to organize ourselves and write the end of semester examination. So these are the highlights for this semester. If you have any questions to ask, I'm giving you the opportunity to ask the question that you want to ask. So probably I can explain things further to you. Okay. Yes. There are a lot of people who don't come for lectures. And I think we have a way of conducting the roll call here. I have all your list. When you click participants, all your list pops out. So we have every meeting, we have the list of students recorded. So if you think that because it's Zoom, you won't come for lectures, be careful. Be careful, because I have all the participants. I can mention your names for you to know that you are all here. I have Abdul Rashid, Khalid, Abdul Wasid, Yakubu, you are here. Abdullah Osman, you are also here. We have Abigail Adakwa, Abigail Adu, Sifa, Abigail Akusia, Deku, Abigail Frimpon, Abigail Sapoma, yes, Sapoma is here. Adams is also here. Adams Salamatu is here. Adai, Seth, Ajay, Reynolds, Williams, Adu, Prince, everybody is around here. So we have the list of students who have joined. And the reason why I said some people will join, but pretend as if they are listening, maybe who have their phone is somewhere else, and they are doing some other things. Either they are washing, cooking their children meal, and they will not follow the lecture. These things have been going on over the years. I have experienced it. So please, if you have joined the lecture, listen to the lecture. Now you have your earpiece, you can join wherever you are. Just that you mute it so we don't pick your background noise. Last time I was teaching and a student with a husband were chatting. And unfortunately, it was a private chat. But the lady forgot to mute the microphone. And everything they were saying and they were private conversations. We shouldn't have heard those ones. It was in our domain. We were listening to it. You have to I have to let the class rep call that girl to do the better thing for us. Anyway, so I'm still waiting for you. If you have any questions, anything that you want clarification before I move on with the actual. Okay. Hello. Yes, I think the network went down. We were disconnected, but I think we are back. With the actual lecture. The rules. Hello. Hello.
Hi.
Yes.
Hi.
Yes, sir, we can hear you.
The network has started misbehaving. I don't know. So I want to hear from you. If you have any questions for the content, or if you have anything you want to add to what we have discussed, the rules are clear. We have a data of your attendance through the participants, and we can record them every now and then. So once we have the list, you don't need to skip lectures. So let's hear you. Yes. John, your hand is up.
Thank you, sir. Please, I think some people have questions, but I think their network is maybe might not permit
Yeah,
them.
so they
They
should
put
chat.
it on the
They
put it on the chat box. There are questions on the chat box. So
So
yeah,
tell them to
there are
use the
questions
chat.
there currently. I think they've kept it there. There are questions there currently.
The questions are there.
Yes, please.
Oh, okay. Okay, then let me look at it. So Ahmed Richie, Ahmed said, please sir, we have been educated on that several years concerning muting your microphone. However, we don't know why some issues occur occasionally. Sir. Yes, so that is, you have to be alert, because I think every lecturer will mention this and it keeps on happening. So because it's electronic gadgets, you need to be alert all the time. Sometimes you are not aware and your hand may even tap on it and you are on mute. and start picking back. So always just check on it to make sure that your microphone is muted. For example, if I'm teaching and the network goes on and then probably and comes back, I'm disconnected and connect again. Quickly, I go to the mute, the microphone, because the moment it does that, the microphone automatically gets muted. And I need to unmute it so you can hear me. So you have, once you are dealing with the Zoom, know how to navigate your way out. Because at every point in time, the microphone will be unmuted or muted. So check on it and make sure that always the microphone is muted, unless we ask you to ask a question. Then you can unmute it and you put across your question. Okay, so that is that. But those who connect it and start going for funerals and weddings, we will not accept that this time. Okay. So the information will be, okay, Isaac Afeke is asking how much is the book, please. The information will be given to the class rep and they will convey them to you. So very soon, very, very soon. So as I said, my boost is not only for Garden City University, it's coming for across all the universities across the country. They get it and they can read it. So if you are in Garden City and you need one, just see your class rep, you'll get one for you. So please, can I get it one at Kingdom Bookshop at Kolebu? I'm yet to contact one staff at Kolebu to get some there for you. So that is Evans. Eva Ishon. Yes, Eva. I'll contact one lady at Kolebu to get one for to connect the one at Kingdom Bookshop at Kolebu for you. But in Kumasi, it is available. Kumasi, it is available. Okay. So please, components of continuous assessment. What do you mean by components of continuous assessment? Or you want to talk about how it's going to be done? I said it's mid-sem, and time will not be on our side to do presentations. So it's mid-sem. We can do 2 of them, and probably we have to find the average. So that is the component. If you are talking about, or you are talking tax, I don't know what you mean by component. If you can come again, this is Azindo, Ndola, Azindo. So your question, if you can come clear, then I can answer you. Okay. Then Gifty Andor, Gifty, please, how much is, oh yes, you get it from your class rep. Your class will communicate that to you very soon. Yes, so. Okay, so far these are the questions that you have asked, and I think that we can continue. Okay. Yes, okay. Some questions still start trickling in. The person is asking, is it possible to get recording after lecture? Oh, I'm not speaking. I'm now speaking. So I'm not speaking. So don't worry, you hear me. The book, I said the price will be communicated to your reps very, very soon. Kojo Samoa said, please, can you enlighten me on your comment? Oh, my comment, you mean what I said or what? I don't know what Kojo Samoa is saying. Kojo Samoa, can you come clear? Kojo, the mystery man, I don't know. Anyway. Oh, but this person, George Adu, the course content have been discussed and definitely to be shared to you. Definitely to be shared to you. I don't know what you mean by sharing to you. It will be put on the platform. So it is up to you. For your class rep, you have to create a WhatsApp platform for medical nursing too. Medical nursing too. And that platform, every information will pass there. So once that platform is created, I think we can share information there. The lectures that we go through, after the lecture, I'll put it there for you to have access. Somebody was asking about the recorded version of the lecture. That one, it is the mandate of the IT people to do it. I don't have control over this. So the IT people deem it fit, or they see it fit that, or they see it right to send it to you. They will send it to you. So that one is not within my domain. So it's for the IT people to do that. Somebody is Prince what? Brobe. So has a book got past questions? Yeah, every textbook has a past question. So this one there, every standard textbook has a past question or questions behind it, not past, just questions for you to try and see how you can test your understanding. So it's a standard textbook. That is it. So can we have the course outline? I just took you through, so definitely I will share that once your WhatsApp page is created. If your rep create the WhatsApp page, I will put it there for you to access it, so you can read around. Yes. Please, I am the only one who can't. No, you are not the only one. I wasn't talking. Please, is it possible to get recorded lecture? The recording will come from the IT. So the IT people, once you contact them, it's possible they may give it to you. Yes. But is it possible to get the this answered several? I think that's all. So comments. That is all for the comments. So we can proceed. So I want to repeat what I said earlier. You have my email on the course content. You have my telephone number on the course content. If there's anything that you don't understand, contact me. If there's anything that you don't understand, contact me. I'm ready, ever ready to assist you. I don't want to hear any incident where students will be talking about things outside our meetings, which might not even be true. So we call it rumor mongering. So those who always try to rumor around, we are mature people here. We are very, 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 very mature. Some of you, it's not, if not anything, you wouldn't have come back here. You are so much mature enough. Some of you have your positions and you have gone through the academic calendar, and because of something, you are coming back for BSc. It doesn't mean you are a child or something. We are all mature. So let us behave very, very maturely. I respect everybody on this platform. And the advice I'm giving you is that if there's anything that you don't understand, my number is there. My email is there. Contact me for explanation. We are not going to create any fanatism here. No. You came purposely for your grade, for your school, for your certificate. Be a student, learn, get your certificate, get the knowledge, and go and continue elsewhere. Don't join the fanatics here. This lecturer is this. Don't create divisions and chaos. You did not come here for chaos, for confusion to be created. Be a student, learn, and go away. The GCUC that you see it there is so big, but if you are not careful, you will not be able to contain you. That garden that you see in there is not just a mere garden. We have timber inside. We have rivers inside. We have big animals inside. We have elephants there and a lot. A word to the wise, this is enough. Okay. So we want to start musculoskeletal assessment. Disorders of the musculoskeletal system. And as a nurse, it is in your jurisdiction that you do assessment for patients who come to you with disorders of the musculoskeletal system. And before you do any assessment, the first thing that you need to do is to do data collection. Data collection. So under the data collection, what do you ask for? You are going to assess basically from basic assessment of functional abilities done by the nurse. So we have various forms of assessment. But the functional abilities, for example, you ask the nurse or you ask the patient, raise up your hand, stretch your arm, lift your head, turn to the left, turn to the right, bend down, stretch up. These are functional abilities. Lift this one, raise this one. So these are functional abilities. So the nurse assesses the patient on the functional abilities. This is done by the nurse. Then to a complete physical examination by the physician for diagnosis of specific disorders of the muscles and joints. So the nurse will first initiate the functional assessment, and the nurse will ask the patient to move for a short distance and go and come. As the patient moves away from you, you observe the gait. You observe how the patient coordinates the movement. You observe how the patient articulates the muscles and the joint in terms of movement. If there's any abnormality, you know. So the nurse initiates these functional ability or assesses the functional ability. After the nurse has finished, then the medical officer will take over and do a complete physical examination. And based on that, we can formulate or arrive at a tentative diagnosis. So we have to do this before we diagnose the patient of any disorder. So the extent of the physical examination will depend on the patient's condition, at least the signs and symptoms that has been exhibited, the health history the patient will present to you, and any other physical sign that you see as a nurse, you see from the patient. That will describe how detailed you should go and to what extent you have to go with your physical examination. If you have something brief, you also become brief. If you have something that is so detailed and comprehensive, then your assessment will also become comprehensive and it will be very, very detailed. So that is how it is. So as a nurse, you are going to take your history as the medical officer on the ward will take a history from the patient. When the nurse is doing an assessment, you also need history taking. So the nurse asks the patient about his chief complaints or cardinal signs. So in other words, you ask the patient, what is really bothering you? Tell me, what really brought you here to this facility? So that's the chief complaint. The patient with a joint injury may report a joint deformity. The patient may even tell you, I have a joint deformity. There is pain, there's stiffness, there's swelling, or there's sensory alteration. I can't bend this toe, I can't stretch this knee. That is sensory alteration. The patient with a fracture may report deformity or pain at the affected site, shortness of the affected site, an abnormal shape of the affected site. The patient may complain all this. The patient with a muscular injury may report pain. So if you have a muscular injury, definitely there will be pain, there will be swelling, there will be weakness or sensory alteration. So these are the history the patient takes when you are doing assessment. So the history continues. Here you are going to ask about his present illness. Present illness. So you ask the patient about his symptoms, including when it started, associated symptoms, where is the patient pain located? At the back, exactly where? So you ask about the location. When the pain starts, where does it radiate to? So sometimes the pain will start from the back, it will radiate to the ribs and come back to the chest. Sometimes it will radiate to the waist and down to the probably left lower limbs. So the patient will tell you all this. How intense is the pain? The intensity of the pain in a scale of 0 to 10. What is the intensity? Does it graduate from 1 to 3, 4, 5, 6 above? Or it starts from 10 and starts coming down? Ask about this. What is the length of time you experience these pains when you start experiencing it? What time does it last? So here you are looking for duration. Within 24 hours, how many times does the pain episode is experienced? The patient will tell you that I experienced this pain twice, once in the morning and once when I'm about to retire on bed. Others will tell you that I experienced this pain more often, about 10 times in a very short interval. So you need to ask about the frequency of pain occurring. Precipitating and alleviating factors. When the pain comes, what do you do to minimize it? Or what do you do to intensify the pain? That if you do something, the pain is very intense, so you have to stop that. So you have to ask about the precipitating and alleviating factors. So you ask the patient if activities of daily living, ADLs, are affected. Are you able to bath, make your meals, sweep your compound, fetch your water? I mean, your daily chores. Is the problem affecting your daily activities? You are a teacher, and now because of this problem, you cannot stand there to teach. You can't write on the board. Is it affecting you? And therefore, you need an assistive device such as cane, walker, or crutches. You need them. We have to support you. Then you ask about the medical history or the drug history. Do you take medications over the counter? Herbal remedies? If the pain starts, where do you get your remedy? Where do you visit first? Last time, we were doing some public health affiliation at Draben, and we happened to meet some students. We asked them, if your mother, your brother, your sister, your father, any of your relatives is sick, where do you seek medical advice first? And you'll be shocked the answer the students gave to us. About 80% of the students said they will visit their pastors for prayers. About 10% of them said they will go to the hospital. And about another 10 said they will go and buy medications from the pharmacy shops. So you understand the perception of a typical Black Ghanaian that anytime there's an ailment or a problem, then somebody is behind it, and therefore they have to go for prayers. Meanwhile, it's not anything or everything that is prayers. There are things that are physical. You face it physically. Definitely, once you get to first semester level 400, you will do a course called New Trends in Nursing, and you will appreciate it. I normally take that course, New Trends in Nursing. And you understand how nurses face spiritual conditions and how are they able to mitigate their way through. So we have a course, Nurse and the Spirituality. So when the condition occurs, when the pain comes, where do you seek remedy? Do you take nutritional supplements? So you are still asking about the medical history. So you ask about other musculoskeletal disorders such as arthritis, gouty, osteoporosis, and trauma. Then you ask the female patient whether she uses an oral contraceptives or is undergoing hormonal therapy, and whether she is premenopausal or postmenopausal symptoms. She is in which stage of her development. And I want to ask the class, why do you think it's necessary to ask these questions when the client is a female? Why do you think when dealing with musculoskeletal disorders and the patient happen to be, or client happen to be a female, what do you think is necessary to ask these questions? Yes, you can talk by unmuting your microphone. You mute it, or you can chat so we can answer you there. Yes, I'm now with the class. I'm the person who like to engage the class so much. So if you are with me, then get ready, you will talk. We have to discuss. It's not everything that should come from the lecturer. We discuss. This is a mature class, and we need your inputs. If you talk a lot, I'll get to know you better, and that is very good. If there's anything, I'll even call you for discussion. If you are the one who observes without talking, whether good or bad, you accept it, then I will never know you. Let's talk, let's chat, let's discuss the content maturely. Yes. So what do you think is necessary for these questions to be asked if the client happens to be a female? Yes. I want to see people's hand raised. I like questions. I remember, yes, Kwame to 4. Yes, Kwame. Kwame hand is raised. Kwame, let's hear from you. Unmute your microphone. Let's hear from you.
Yeah, okay, sir. So we know from anatomy that
Can you speak? Can you
these
bring out your voice a bit?
yes. Okay, so I was saying that we know from anatomy that these hormones play a vital role when it comes to bone strength and bone development, the estrogen and co.
Sure.
So, in a case whereby we have a postmenopausal woman, which in this case they have low levels of these hormones, it affects their bone development. So, they are at risk for conditions with regards to the musculoskeletal system, especially osteoporosis. So we would want to find out in that
Very well
regards.
said. Very well said. Yes, fantastic submission, Kwame. This is good submission. You've said it all. Thank you for this wonderful submission. This is how we learn. You see, knowledge is not only with one particular portfolio. Okay. Then from Baba Maswell, Baba said, the continual use of oral hormonal therapy contraceptives cause osteoporosis and affect their bones density. That is Babu Maxwell. That's what the name I see here, Babu Maxwell. Okay, so Maxwell, this is your submission is also good, and that is true, because once you are a female and you are getting to the premenopause and the menopausal stage, there is withdrawal of the estrogen, and once estrogen is withdrawn, it affects the bone density, because estrogen has a direct effect of your calcium and vitamin D. Simply put, estrogen has a direct effect on calcium and vitamin D. And once estrogen is withdrawn in your menopausal stage, definitely your calcium levels and vitamin D levels are also going to be withdrawn. And once they are withdrawn, it affects the bone density. The bone becomes brittle and weak, which prones or puts you at risk for fractures and other musculoskeletal disorders at the joint. Arthritis is common at this stage. And you bear with me that at that stage, they complain a lot about their knee joint, their waist. Is because at that time, they need supplements. If you are a nurse, you ask the person to get supplements because of the withdrawal of hormones, and they need supplements. These supplements are available that they get restored externally. That will reduce the rate at which the joints are being affected by arthritis. So it is just, by the way, that is how we learn. We learn by applying so many things, concepts, to explain other things. So you ask all these questions. You assess the family history. Yes, there are some families, by the time you hit 40 years, you start complaining joint pains, waist pain. Somebody has entered and has unmuted the microphone, is disturbing. Please unmute your microphone. I just made this. The person is, she has quickly unmuted. I was going to mention your name. If you do this, I will mention your name, and then we shame you. Yes. Mention and shame you, so you learn. So there are some families by the age of 40, they've started complaining of joint pains, waist pains, knee. So it runs in families. Some conditions, they are very common in families. So is the patient in front of you having the problem? Is it coming from the genetics, hereditary? Where is it coming from? So we have to know. So we have to ask about the family history. So family history of musculoskeletal problems. Also ask about family history of chronic and genetic conditions. Show your social history, whether you are the type who is active or you are the type who is very, very dormant. The rate, are you working? How often do you exercise? Your diet that you take in, is it even a well-balanced diet? Do you use recreational drugs and alcohol? How is your hobby? All these affect your musculoskeletal system. If you are the type who like exercise, you know, there is a direct relationship between exercise and the level of calcium and vitamin D. And the bones start absorbing calcium from the blood and direct the calcium into the bones through exercise. So during exercises, the total body calcium goes down because they all move into the bones and joint and strengthen the bones and joint. During period of inactivity, now there's a reverse. The calcium and everything starts moving away from the bones and it increases the level in the blood, making the bones brittle and weak, which predisposes you to fractures and joint conditions. So there is a direct relationship between exercise and arthritis or bone strength. You also asked about stress. Stress also affects the rate at which minerals move into the bones. If you are the type who is more stressful, then we need to know why you are experiencing joint pains early because of the stress. Support system. Do you have people who support you at home, at workplaces? And coping mechanisms. What are your coping mechanisms? Assess how the patient functions at home. Some people, some of the women at home, they get so much tired. The stress level at work and home is too much for them to, combine, and there is no support. The man will not bother to even give some hand, extra hand to this woman. And combining this, you stress this woman so much. And the woman will become very, very weak early, complain of joint pains because of the stress levels. Do you have to care about extra hand for this particular patient who is so much stressful at home and workplaces? Can you climb your stairs? Do you live upstairs? Do you drive? All these are questions you ask, and that's the social history. Then it comes to the physical assessment. You begin with inspection. With inspection, you are looking at the size and shape of the joints, the limbs, and then the body regions. Here I said you have to ask the patient to go. Just move some distance. Then you keep an eye on the patient. Body regions, body symmetry. Some people will walk and they've shifted to one side. Some will sit on the motor bicycle and they've shifted to one side. They are not straight. Inspect the skin and tissues around the joint. What is the color of the skin at the joint? Is it too dark? Is blood really circulating well? The color of the skin and the tissues will determine whether you are even well nourished or not. If you are anemic and malnourished, it will even reflect on your skin, your limbs, or the body regions for color, swelling, masses, and deformities. Move around your hand from the cervical area to the sacral area.
Giving you 3 minutes. Everybody should sit. The lady should sit here. The guy should sit here. Take your Quran. Hey, Abdulhaq, read the first line.
Hello?
Stand up and
Hello?
open your mouth.
Hello, class.
Hello, sir.
Hello, sir.
Yeah, hello, sir.
Hello, sir.
Wallah, what? Huh? 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 The power is what? He said Gappa, the power is what? Moin, read the first line.
Musa, please mute your mic.
Is it Lima or Lima?
He's being taught and he's also teaching somewhere. That's serious.
Go and pick your hand. Don't sit idle.
Umar Suleiman Musa, please mute your mic.
Musa, mute your mic.
Hello? Hello?
Hello, sir.
Hi.
Yes. Sorry, I don't know why the network is disturbing me so much here. It keeps disconnecting me anytime I connect. Now, it looks a bit stable. It's even a Wi-Fi. I don't know why it's doing that. So, if we can continue, please, let's continue. So, I was on my point of explaining physical examination or assessment of the patient. When the nurse is doing this, we call it, so the first phase of physical assessment starts with inspection. So with inspection, you are inspecting the size and the shape of the joint. Is the joint swelling? How big is the joint in terms of its swelling? How is the shape? Is the shape normal shape or is abnormal? the limbs. Is the patient able to throw the limbs as the patient walks, or the limbs are being thrown abnormally when the patient moves away from you? And the body regions, the chest, the back, the hip, the abdomen. These are the regions Hello? Hello?
Hello. Hi.
Yes, please. I'm trying all my best. Yes, I'm trying my best to connect you. So I don't know why the network is behaving this way, but let's do something. Let's hope it stays like this without going off. So I was talking about inspection. So with inspection, you go all around, inspect the joint, the cavities for deformities. At the back, you move your hand from the cervical area through the vertebral column down to the sacral area, inspecting abnormality at the back. You are inspecting how the patient stands and move. Watch him walk, noting his gait, posture.
Yusuf Imoro, please mute your microphone.
Hello? Hello?
Hi.
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 So let's move on. So when you are inspecting, you inspect the curvature of the spine. And the reason why I said you have to move your hand through the vertebral column. So if you move your hand, you are checking for the curvature, whether you have lordosis, spondylosis, or whatever. You are checking for that. Then you have to check the range of motion. Ask the patient to abduct, and flex or extend the affected joint. So here, so what is the meaning of abduct and adduct? Yes, when you say abduct, what is it? Yes, when you are abducting and adducting, what's the difference? And then uh, you extend and then you flex.
Hey, madam. Madam. Kafra, 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 kafra.
Madam Barbara, mute your mic.
Oh, sorry.
Madam Barbara Opoku, please mute your mic.
Enjavre mambento banka. Missiono beka.
You should know
Asana,
better.
please mute yourself.